So you have the flu. What is the flu anyways? The Centers for Disease Control and Prevention, or CDC, defines influenza, or the flu, as a contagious respiratory illness caused by influenza viruses that infect the nose, throat, and lungs. How did I get the flu? The flu is spread through droplets. The flu viruses sit on these droplets and use them as a way to leave one person and infect another. These droplets are produced when someone coughs, sneezes, or talks. Once these droplets leave one person, they can spread up to 6 feet away. These droplets can either land on objects or another person's body. It is important to note that someone may get sick from coming in contact with objects contaminated with flu viruses. That is because the flu virus can live on them for a number of hours. These droplets can enter the body through openings like the mouth and nose. This can happen from a direct spray of droplets entering these openings or from touching something contaminated and then touching the mouth or nose. The picture on the right shows 5 people waiting in a doctor's office. You can see there are flu viruses in the air. One of the people in the picture may have the flu and is spreading it to others. Perhaps it was the mother sneezing and talking to the child on her lap. Her droplets will spread up to 6 feet away, possibly landing in the mouth of the man next to her and on the tablet and book the other patients are holding. When these patients touch their tablet or book and then touch their face, they could be introducing the virus to their body. What are the signs and symptoms? The common signs and symptoms of the flu include fever, aching muscles, chills and sweats, headache, dry persistent cough, shortness of breath, tiredness and weakness, runny or stuffy nose, sore throat, eye pain, and vomiting and diarrhea, though vomiting and diarrhea is often only experienced by children. Emergency symptoms are serious and require you to seek medical help. Heading to the hospital should be your next step if you have any of the following symptoms: difficulty breathing, chest pain, ongoing dizziness, seizures, worsening of an existing medical condition, severe weakness or muscle pain, blue lips, which is primarily seen in children, and dehydration. How do I know I just don't have a cold? One way you can tell you do not have a cold is the speed at which your illness develops. The flu develops much faster than the common cold. Another way to tell which illness you have is how poor you feel. The flu will make you feel much worse than the common cold. Along with those tips, using this table provided by the CDC can help you figure out whether you have a cold or the flu. This chart compares signs and symptoms and how they occur in each illness. Please feel free to pause the video to spend more time looking at the chart. Am I at risk for developing severe illness? People at risk for developing severe flu include those who are 65 years or older, those with certain chronic medical conditions like asthma, diabetes, and heart disease, those who are pregnant, and children who are younger than 5, especially children under 2 years old. Can I give the flu to anyone? Yes, you can give the flu to anyone. The flu is a contagious disease and spreads from person to person through the infected person's droplets. If you have the flu, you are most contagious during the first 3 to 4 days after the start of your illness. Although you will be most contagious during the first 3 to 4 days, if you are an adult, you can still infect someone one day before your symptoms develop and up to 5 to 7 days after becoming sick. For children and those with weakened immune systems who have the flu, you can infect people for longer than 7 days after becoming sick. What can I do to feel better? The flu is typically treated at home unless you are experiencing the emergency symptoms listed earlier. While treating the flu, you will often just let the illness run its course and treat the symptoms you experience. One way to help yourself feel better is by drinking plenty of fluids. This will prevent dehydration, which can cause a multitude of other problems. Some examples of fluids you can drink are water, juice, and brothy soups. The next way to help yourself feel better is by getting plenty of rest. Try to spend the day in bed or on the couch. Take naps when you feel you need them. Resting helps your immune system fight the infection. The last way to help yourself feel better at home is by taking over-the-counter pain relievers. These will help alleviate the aches that often come along with the flu. Some examples of pain-relieving medications are acetaminophen and ibuprofen. For some people, taking an antiviral medication may be the route to take when it comes to treating the flu. In order to obtain a flu antiviral medication, you must visit a health professional and receive a prescription. You cannot get antivirals over the counter. Flu antiviral medications will help your immune system fight the infection in the respiratory tract. Antivirals are helpful because they can make the illness milder, shorten the amount of time you are sick, and they can prevent serious complications like pneumonia from occurring. Flu antivirals should be used early in the illness, as this is when they work the best. Antiviral medications are especially important for the high-risk individuals described earlier. This is because they can prevent serious illness and complications. It is important to note that antiviral medications are not the same as antibiotics. This means that using an antibiotic will not help you if you are sick with the flu. There are several different types of flu antiviral medications, the most common being Tamiflu. Here is a list of some other types with their generic and brand name written out. How can I prevent myself from getting the flu in the future? There are many different ways to prevent yourself from getting the flu. One of these is to avoid close contact with sick individuals. This keeps you from being exposed to the droplets. Another important step is to cover your mouth and nose. This keeps the virus from getting into your body, as these are often its access points. Cleaning your hands with soap and water is important in preventing the flu as well as many other contagious diseases. If soap and water is not available, an alcohol-based hand rub can be used. Another step is to avoid touching your eyes, nose, and mouth. As stated before, these are places the virus can enter your body. Practicing good health habits will keep your immune system in top shape, allowing it and the rest of your body to be strong enough to fight off infection. Good health habits can include eating a healthy diet, getting enough sleep, exercising, and reducing stress. Lastly, getting a flu vaccine yearly will help keep you from getting the flu. The vaccine is a safe and effective way to train your body on how to fight the flu. For more information on the flu, you can visit the CDC's website at www.cdc.gov/flu. Thank you for watching this video.